Hi, this is Andy Foreman. This is Disability Connections, a show that helps you make a connection with the disability community. My guest today, John Kelly, who is the regional director of the Not Dead Yet and the director of Second Thoughts New England. And my name is Andy Foreman. We'd love to entertain questions, comment. We're talking about assisted suicide today and how that relates to the disability community in particular. 617-708-3290, blocked call *82. Again, 617-708-3290, blocked number *82. John Kelly, welcome into the connection.
Thank you very much, Andy.
So, tell me your titles again.
Sure. I'm the director of Second Thoughts Massachusetts, Disability Rights Advocates Against Assisted Suicide, and I'm also the New England Regional Director for Not Dead Yet, which is the national grassroots organization which has been fighting against the devaluation of disabled people's lives since 1996, when Jack Kevorkian was on his killing spree.
Okay. Tell me a little bit more about Not Dead Yet, Second Thoughts New England, or
Sure.
Second Thoughts Massachusetts.
Not Dead Yet started, as I said, when Jack Kevorkian was delivering death to people. And although the media often presented it as a case of a doctor helping terminally ill people, it turns out that more than half of the people who died under his auspices were not terminally ill, but were disabled. A few were not disabled at all, had nothing wrong with them but psychological distress. We were outraged by this, and we organized so that we could have a disability rights presence about this issue, and it was only after we swarmed the courtroom during the final trial that he was convicted and sent to prison. We wanted people to know for a fact that this practice affects us directly and that disability rights organizations oppose it.
Do you think without the presence and without the voices of people with disabilities in that courtroom, Dr. Kevorkian would have been convicted?
Well, we don't know because they had a tape of him killing someone that was shown on TV, so that was pretty good evidence. But the previous cases had resulted in hung juries. And it's only when people really see that real people are being affected by this that we are committed and will be loud about this issue, that, hopefully more and more people will realize that assisted suicide is not a solution and will have second thoughts, which is the origin of our name in Massachusetts. Second Thoughts Massachusetts is the state affiliate of Not Dead Yet, and we coordinate opposition to assisted suicide. We also do work with other disability rights groups on any devaluation of disabled people's lives, such as the Autistic Self-Advocacy Network and the annual Day of Mourning in the spring every year, and that's been held since 2012, because the media was continuing to cover positively the murders of disabled people, especially autistic people, by caregivers and parents. And we are proud participants in that every year.
So let's define our terms a little bit here. When we're talking about assisted suicide, are we talking, you just mentioned caregivers, are we talking about by folks like a Dr. Jack Kevorkian? Are we talking about by personal care attendants? All the above? We're talking about someone's mom?
Well-
Anyone? So basically, is it anyone that assists in putting together a cocktail, a dangerous cocktail to end somebody's life?
Well, the way we commonly understand it is that assisted suicide begins with a doctor writing people a prescription for a lethal prescription of drugs, typically 100 capsules of the barbiturate seconal. Then the doctor's role ends with the writing of the prescription.
Okay.
Then anyone can go to the pharmacist, pick up the drugs, and bring them home because there's no official witness required at the death. That means that anyone can take action and there's no way for anyone to know about it. So yes, someone's parent, someone's relative,
Could help them.
someone in line to inherit money from the estate, an heir, someone who was in line to inherit, could encourage someone to sign up, be one of the two witnesses for the request, and pick up the drugs, bring them home, administer them with no questions asked. What these laws do is immunize everyone who may be involved in the death of the person.
So how does it get to the point where a doctor who has taken this Hippocratic oath to save lives and to improve the quality of people's lives, how do we get to the point where you're saying, hey, doctor, put together this massive amounts of drugs that'll kill me?
Tortured logic. That's how we get here. Doctors do take the Hippocratic oath. First, do no harm. Either cure or comfort people and to be with them. Assisted suicide represents a radical break in that doctors under assisted suicide are empowered to pass judgment on the quality of someone's life, perhaps agree with someone in suicidal despair that they would indeed be better off dead. And so it just takes one doctor and their colleague to agree that you have a terminal illness or you have a disability that might result in death in the foreseeable future, and they can prescribe you these drugs.
Does it start with the individual? Does the individual say, hey, doc, I'm done?
Well, that's the idealized fantasy of assisted suicide, that the impetus and the choice only comes from the individual, as if everyone else is neutral and has no impact upon people. And that's what proponents pretend, that it's about one individual and their choice discussed with their doctor. But the reality is that many doctors do not want to prescribe it, and doctors who may see depression in their patient have been appalled to learn that that patient went to another doctor who knew nothing about their medical history and got a prescription. So in Oregon, a few doctors have prescribed a lot of the doses, and the proponent organization out there has referred more than, I think, 3/4 of the people to specific doctors that they have identified. And these doctors, they don't need to be specialists in the field at all. They don't need to know about palliative care either.
Do these doctors, do they go into prejudging the situation, saying, I believe it's better that Andy ends his life? Do they have to be convinced? I mean, I'm just thinking, if I went to my doctor, I would hope my doctor would kind of talk me out of it and convince me, and I'm a person with a disability, but
yes,
I would hope that happens.
We would hope that happens.
Does it?
Well, some doctors do try to persuade people not to do it, but the thing about these laws, it just takes one doctor and their friendly colleague and
To make this
to make
decision.
this decision. So we have the example of Katherine Judson, who brought her seriously ill husband in to see the doctor, and she was hoping to get some help. But she was surprised to overhear the doctor making a sales pitch for assisted suicide to her husband. And the clinching argument the doctor used was, think about your wife. We have to think about her. And this is the kind of real social pressures that we always feel.
It's almost like you're a burden
Exactly.
to your loved ones or whatever.
Well, doctors who fill out the questionnaires out in Oregon and Washington talking about so-called end-of-life concerns, over 40% say that people report feeling like a burden on others. And the reality is that feeling like a burden is just a horrible feeling. Many people with disabilities have been put into a situation where we may feel that way, and that's why society should provide supports so that people can interact with those around them, except in a strictly caring perspective.
But people with disabilities don't feel they're a burden, but they have to be convinced of that, do you think?
Well, some do. I mean, the whole independence rights movement was about independent living movement was about showing people and proclaiming the right and ability of disabled people to live on our own in the community with appropriate supports. And for people who have a terminal illness, supposedly, they also should be provided supports, and the state should be providing funded in-home supports, make sure that people can access treatment. One of the big problems is that assisted suicide will always be the cheapest treatment.
Sure. Because you don't have to spend money on the personal care attendant or whatever, right? Yeah,
or the treatment that the insurance company doesn't want to cover. And with the threat to the Affordable Care Act, it's just incredibly irresponsible that anyone would be proposing a bill that could easily lead to the deaths of people because an insurance company or a cash-strapped state Medicaid system says, no, we can't afford your treatment, but here you can have assisted suicide. There's the recent case of Stephanie Packer out in California who, after assisted suicide went into effect in California, received a letter from her insurer saying that they would no longer agree to fund her treatment. When she checked, she found out that her copay for assisted suicide would be $1.20. People will lose their lives to the bottom line, to misdiagnosis. I mean, just about everyone knows someone who's been misdiagnosed. Ted Kennedy, for example, was given 2 to 4 months to live, and he lived 15 more. We have members in the disability community who have been diagnosed as terminal multiple times, some since birth. So we know that doctors are often wrong, and that it's an outrage and a tragedy that people would be put into a situation where their lives could be ended by the mistake of one other human being and their friend.
We talk about how money but isn't the bottom line here value, moral? I mean, it's how we want to, what we value in life. And do we value, whether we're talking about the Affordable Care Act or assisted suicide, you're talking about what do we value? Do we mind?
Well, we're talking about the foundation of democracy, equal protection under the laws. All civil rights movements have drawn on this guarantee to demand that we receive fair treatment compared to everyone else. And for a state to, on the one hand, be trying to prevent suicide among younger, non-disabled people while allowing, even encouraging suicide for older people is a gross violation of disabled people's rights. Because when you come down to it, the reason people seek assisted suicide and why those around them push them to it is because of disabilities. And often the initial shock or difficulty adjusting to loss of physical abilities, loss of control of bladder or bowels, issues that people with disabilities know well and are able to manage in a life that we know is valuable.
In preparation for this show, I was watching a bunch of videos on YouTube and the internet, and I saw an interview from, I forget the gentleman's name, from Oregon who had Lou Gehrig's disease. And the interviewer was talking about the quality of life. And he said, yes, I am totally dependent for all my activities of daily living and instrumental activities of daily living, but I have a great quality of life because I have a great family and lots of friends who love me and care about me. So I guess what I'm talking about is it matters how we define our terms.
Well, it's do we get to determine the value of our own lives, or is society and well-funded proponents going to push through a law that says that some people's lives are less valuable and may not be worth preserving?
Right.
People with a so-called poor quality of life. And the problem, Andy, is that no matter how many times disabled people proclaim the value of our lives, say we love our lives, the non-disabled majority, the elites who run media and institutions in this country ignore it. That's not the answer they want to hear because they look down on us so much, they think our status is so below them that they can't imagine joining us and would rather die than do that. That's why they talk about this insulting word dignity, as if we don't have dignity to have someone assisting us with our activities of daily living. And we're just outraged that this word dignity is used to kill us.
Yes, no, I agree. We're sitting here talking with John Kelly. We're talking about assisted suicide. John Kelly is the director of Second Thoughts, Massachusetts. He is the regional director of Not Dead Yet advocacy groups that are trying to help defeat assisted suicide laws nationally. Our telephone number is 617-708-3290. If you have a blocked number, star 82. Again, 617-708-3290. My name is Andy Foreman. John, talk to me about, I know there was a bill that was defeated a while ago here in Massachusetts.
Right.
There's another one, you were telling me before, H, the number, but
Right.
There's a bill. So what is the status of that?
Well, first of all, Second Thoughts Massachusetts started in 2011 in anticipation of the referendum on assisted suicide that was held in 2012. And we were active against it, working with doctors groups, disabled people, progressives, and faith-based organizations. And we were able to defeat it based on the strong turnout of people of color who came out to vote for Elizabeth Warren and Barack Obama. And that's what we need to do for the ballot that's almost certainly coming in 2018, is turn out a broad coalition. People who are not accustomed to full control in their lives without doctors they can trust, people from marginalized communities like disabled people, people of color. We know what it's like to be disrespected by doctors and the medical industry, and so that's why we fight against it. So right now there is a bill in the legislature which we are fighting against, H 1194, which they call an End-of-Life Options Act. But the rub is that we don't know when the end of life is. No one can predict. And thousands of people graduate from their 6-month hospice eligibility every year. You know, one person out in Oregon, Jeanette Hall, she voted for the referendum for assisted suicide when it came before the people. And when she herself got a terminal diagnosis, she was afraid of suffering because that's what had been talked about so much, and she went to her doctor for assisted suicide prescription. He persuaded her to try more treatment. Eventually she relented and did, and 17 years later she's alive. So we can't see any upside to a bill like this when, you know, public health has to consider everyone in a state, not just people with ideal, loving families where everyone is unified behind them.
Why is this, why do these, I mean, so this is every 6 years, basically, the bill. Last time the bill was on the ballot was
2012.
2012. So every 6 years.
Every 6 years we can expect to see this bill because the state constitution forbids resubmitting a bill to the people, you know, unless you wait 3 legislative sessions. So yes, they are relentless. We defeated them in 23 states this year across the country. And, you know, we find that the more people learn about the problems with misdiagnosis, insurance companies denying treatment, with abuse, I haven't mentioned that enough here, but 1 out of 10 elders in Massachusetts is estimated to be abused every year. And 90% of that is by family members. So how can we pass a law in which it's open season? You know, once those drugs come home, there's no more supervision and, you know, no family notification, no nothing. You know, if you have a family member who's been very depressed and has a serious illness, you may not know about their death until after it happens.
So my viewers out there, people that want to, you talk about developing a broad coalition, not just people with disabilities, but a broad coalition. My viewers out there, they want to get involved. What do they do?
Well, they could contact me directly at secondthoughtskelly@gmail.com, and the second is spelled out, or they could go to Second Thoughts website at www.second-thoughts.org. And again, the word second is spelled out.
SECOND thoughts.
Exactly. Okay. Another great resource is Not Dead Yet, which is online at notdeadyet.org.
So what types of things could folks do to get involved?
Well, some activities include learning how to talk about assisted suicide. Many people feel bashful about it, like it's not a political issue, but it's just a personal issue. And we're trying to get people to see that while people may think it's an individual issue, it's really a broad social policy issue with interests behind it.
So your biggest weapon is education.
Our biggest weapon is education and people who can testify against it. There will be a hearing in September 26th. And if people have stories, they could come testify.
At the State
We
House.
need doctors. We need hospice workers. We need people with disabilities. Really, everyone has a stake in this because every resident of Massachusetts is one misdiagnosis, one abusive relative, and one greedy insurance company away from being at the edge of death.
Great.
Unnecessarily.
Well, I thank you very much, John, for giving us just the tip or the just the beginnings of this whole discussion. It can be hard for people to have, and I'm glad you're here, and I'm glad you're fighting, and I'm glad Not Dead Yet, Second Thoughts Mass exist. And I wish you all the best, and hopefully we can get more and more people involved and
Thank you very much,
educate.
Andy. It's been my pleasure.
This has been Disability Connections. Hopefully I helped you make a connection with the disability rights issue of assisted suicide. My name is Andy Foreman. This is Disability Connections. Thanks for watching.